So the bill that is before us, which is Senate Bill 977, an act concerning medical assistance for surgery and medical services related to treatment of obesity, it's a very straightforward bill. Effectively, what it's going to do is expand Medicaid coverage for obesity, and in particular for bariatric surgery and many other things, potentially prescription drugs, counseling, and so on, to help people that are suffering with obesity. And I'll start by saying that everyone in this room, and certainly people across our society, are sympathetic to people facing any type of medical crisis or concern. And obesity, I can see the argument being made that somehow this is more than a personal choice. It can also be a medical condition as well. That being said, I do have a few questions about this bill and where we are headed as a society. The first question I have, through you, Madam President, really has to do with just how much of an expansion this is. I heard several quotes from the chairman and also from some of our colleagues around the circle about how significant a increase in coverage this is going to be. It was mentioned that this is, quote unquote, a massive public health crisis. And it was also mentioned that around 120,000 people in Connecticut are experiencing obesity in the state. So it seems to me that this could ultimately end up being a significant increase in the amount that the state must budget for Medicaid. But I notice online that there is no dollar amount associated with the fiscal note. And I find that troubling, to say the least, and extremely unusual. Through you, Madam President, I'm wondering if the chairman can give me any more detail about the potential cost for this particular policy.
Senator Lesser.
Yes, thank you, Madam President. Madam President, there is a fiscal note. It doesn't have a specific dollar amount, as the gentleman noted, but it does potentially result in a cost to the state. I would just note that currently the Department of Social Services does provide coverage for bariatric surgery for severe obesity under certain circumstances. My reading of the bill gives the department more flexibility, to be honest, by allowing, in addition to bariatric surgery, also providing an additional suite of options in terms of management of that particular condition. And the two additional options that might indeed be more cost effective that are specifically listed in this bill are outpatient medication treatment as well as nutritional counseling. Through you.
Thank you, Senator Sampson.
Thank you very much, Madam President. I appreciate that answer. And I certainly get the fact that if we give patients more options, or the Department of Social Services more options on how to treat folks experiencing obesity, that in some cases there is now no doubt going to be a cost benefit because people will choose a method that might cost less but ultimately result in savings over the course of their life. And I get that, and I want to be sympathetic to that. But that seems like a major walk back from the way the bill was originally introduced as a huge benefit for the state of Connecticut and a massive public health crisis, as I was quoting earlier, and that 20% of healthcare expenditures in the state of Connecticut somehow are traced back to it. So to me, that's a mixed message. This is a huge thing. It's going to help so many people, and it's therefore it's going to cost a lot. To now we're talking about savings. And without having a fiscal note to tell us really what's going to happen, it's very hard to make a determination. But I would suggest, based on the way this bill was introduced and the words on the paper, it is quite clear to me that we are talking about a very, very large expansion of costs under the Medicaid and Husky B coverages. I think one of the ways that that the state limits the coverage currently is that it limits it to people that have medical conditions that contribute to obesity. Senator Anwar, in his remarks, referred to the fact that this is sometimes a result of people that suffer from various medical conditions. Am I correct that this bill before us is going to expand this coverage effectively to people for any reason, not just limiting it to people to have a medical condition. Is that correct through you, Madam President?
Senator Lesser.
Madam President, through you, there are two different triggers in the bill. At BMI of 35, it does require a comorbid condition, but the specific concern over BMI of 40 is that itself is a major health risk for a whole host of different medical issues, and so and that's why in this case the BMI of 40 is the trigger used in this bill.
Senator Sampson.
Thank you, Madam President. I appreciate that answer. So I'm in fact correct that if you hit BMI 40, it's going to cover you regardless of the cause of that occurring in your life. I would also just ask, there was some conversation earlier about counseling and that type of help as opposed to surgery or even prescription drugs. Is there a limit on that counseling through you, Madam President, or is it the potential there that someone might be able to benefit from counseling for their entire lifetime? Through you, Madam President.
Senator Lesser.
Through you, that would be up to the Department of Social Services, and my understanding based on other areas where they provide coverage is that they would subject that to reasonable limits. Through you.
Senator Sampson.
Thank you very much, Madam President. I'm done with my questions. I think that the chairman and I have different experiences with the state government. My experience is that they're not going to keep it within reasonable limits. They are going to continue to expand our state government and the cost to every taxpayer over and over again ad nauseum. And that is my concern with this bill. We have really got to get a hold of our situation as a society. We have got to decide what world we want to live in. Do we want to live in America as founded, a country of free people who make their own decisions and their own choices and also suffer the consequences, good and bad, for those decisions? Or do we want to live in a socialist or communist country? We've got to decide. This bill takes us another step towards communism. That's what it does. Now, I understand that we want to provide help for people in our society that are disadvantaged and cannot afford to do so. But this bill takes that a whole step beyond where it needs to be. Even people that would rightfully say that we need to have a safety net as part of our culture would have to pause when faced with the coverage that is before us, especially given the information that we just discovered in my little Q&A with the chairman, that this goes beyond just people that have a medical condition. This is also going to take care of people that simply make bad personal choices about their health decisions. It's also going to extend to people's ability to get services at the whim of a state agency, which relies on having those people to take care of for their own jobs to exist. And contrary to the discussion about potentially saving money, the fiscal note, or rather lack thereone, still states the bill will increase the number of individuals eligible for both surgical and medical services, which will increase state costs. And the question is how much? But I think it's quite clear, the way this bill was brought out, that it's going to increase those costs massively. Just like this is a massive public health crisis, you're talking about a massive cost to cover it. Like I said, I am sympathetic to people that are facing these problems. But in many respects, we are talking about people that are making choices each day that impact their lives. And I would like very much for our society to empower people to make better choices. Holding people responsible for their own outcomes is actually a positive. History has proven this time and time again, that when you create systems of dependency, you get dependence. And I'm afraid that that's what the majority wants. They want us to live in a society that is dependent on the government. And almost every aspect of the policy that we debate in here is all about that. The majority is trying to find ways to expand government, expand people's dependency on government, and therefore reliance. It's very dangerous, and it is an exact opposite direction of where this country was intended to go by its founders. If I have to go home and ask my neighbors, the taxpayers in my district, whether or not this is a viable cost for them to take money out of their pocket to pay for, I'm betting more than 50% of them say no. I'm betting that a lot more than 50% of them say no. Because at the end of the day, these bills that come before us, while they sound great, they all sound great. We're going to be providing this for people. We're going to be helping people. We're going to be making things better. Often the other side of the equation is left out. And I want to remind everyone it is an equals in between the occasion. The amount of money that we spend to help people is also the amount of money that we have to take from people, maybe against their will, and use for purposes that they don't even agree with. And so few people are willing to get up and talk about that side of the equation, and that's what I'm doing here today, Madam President. I'm reminding people that when we do this, we are costing taxpayers money. And we are not asking them ahead of time whether they can afford it. We are simply spending their money without even asking them. It's wrong. And there have to be limitations. At what point do we say, yes, it would be great if there was money in the budget to help people do X, but there's not enough money in the budget to help people do Y? Where is that point between X and Y? Where is it? I think it's way before this. We better figure it out. That's all I'm suggesting to my colleagues. We better figure it out. Because if we don't, we're going to end up in a society where no one is responsible for themselves anymore. This bill says you're not responsible for your own health decisions. That's what it says. It says, don't worry, the state will take money out of some other person's pocket and take care of you if you make bad health decisions. What kind of message is that? It's not the one I want to send, Madam President. I will be a no on this bill.
Thank you. The machine is locked. Mr. Clerk, please announce the tally. Please do not wander far.
Senate Bill 977, total number voting 35, total voting yea 30, total voting nay 5, absent not voting 1.
Legislation